have to go through the introduction again, okay? Okay, so hi, my name is Sam Kippen. My student number is T00698764, and this is my clinical mentor, Dr. White. He's going to be working with me today with Button while we do an ear exam and we medicate Button's ears. So I'm going to also pretend like Ian, or Dr. White here, is the owner of Button. So I'm going to ask him about the history. So has Button had any ear problems?
I don't think so, but I'm just concerned he might have. He shakes his head a little bit.
Okay, and any ear problems in the past at all?
No, he's never had an ear problem.
And does it seem to be one ear or both?
I'm not sure. He just shakes his head and I can't really tell.
Okay, well we will look at both ears here for you today. So we're going to start with a hearing evaluation. So I'm going to clap my hands really loud and see if the Button notices at all. So that got Button's attention, so Button can hear, which is great. External ear exam. So I'm going to be looking at the pinna here. So I'm just going to be looking at the ear, looking for any lesions. Everything appears to be normal. No swelling or abnormalities or redness on the ear. It appears to be pretty white with a light pink, which is how we want it to be. And then I'm going to do the otoscope exam. So I'm going to take my otoscope. Button's fairly small here. So I'm going to take a small earpiece. But again, we do have many different earpieces to choose from. I'm going to take this small one and put it on the otoscope and turn the otoscope on. So if you can just hold on to his head here, and we'll look down Button's ear. Okay, here we go. So now I'm able to see down the horizontal canal down the vertical canal into the horizontal canal, and I'm able to see there the clear but maybe a little bit shiny white tympanic membrane, which is great. So that's the eardrum. Now I'm going to switch for the earpieces. Take this one out and put a new one in, just in case he did have an infection. We don't want to spread it to the other ear. And the same thing in this ear. I'm going to go down the external auditory canal, the vertical and then the horizontal. Here we go. Yep. As you can see, again, the tympanic membrane there. So we're good. Everything looks clean and clear in Button's ears. So nothing to worry about there. I'm going to make sure to turn this off. Do you feel like we need to do an ear swab in Button's ears?
They're nice and clean.
Okay, well, if they're nice and clean.
I don't think we have to unless you need to.
Nope. Okay.
It would be exactly the same as what you did in the dog.
Yes, and then pluck here. Ear hair. Do you feel like we need to pluck the ear hair?
He doesn't need any plucking.
And it doesn't look like it. So a simple clean. So then I will take the Trizid. Okay, some gauze. I'm going to do the same thing as like what I did with Hunter. So if you can just hold on to his head, I'm going to take this and fill the ear canal. You can see that it's overfilling there, which is great. I'm just going to take this and go down and clean out any debris. As you can see, I'm not getting a lot of debris in there. His ears are pretty clean. I'll do it one more time just to be sure. But I'm not getting anything, which is great. So I'll do the other ear. So we're filling again now. I will take some more gauze. Again, we're not getting very much there. And I'll do here with the pinna. Just make sure that there's no debris or anything on there. Which there's not, that's great. It's a very clean ear. So medicate as directed by my clinical mentor. How would you like me to medicate?
Well, he doesn't need treatment at all, but if you want to use the ear wash and pretend it's ointment and demonstrate.
Okay. So if you did have a problem and you did need treatment, then I would put the number of drops in as directed by my clinical mentor.
If it was, it would be 5 or 6 drops if it wasn't
So
real
I'll be
medication.
pretending I'm putting down 5 or 6 drops. So I want to make sure that I can watch it go down the ear canal. 3, 4, 5, 6. And then it's important to give it a really good massage afterwards to make sure that it covers the entire external auditory canal, the vertical and the horizontal. Here we go. And then move over to the other ear. Just gonna wipe this off quickly before going into the other ear. And then 5 or 6 drops in this one as well.
Correct.
3, 4, 5, 6. So 6 drops in there. I'm gonna give it a really good massage again. Okay. And we are all done. Buttons ear exam.